10 pounds, 4.5 kilos might not sound like a lot, but losing just that amount of weight can have a major effect on how well our bodies function. And it's not just about heart health and blood pressure. Dr. Yves Benabu is a radiologist who specializes in joint and pain management. Hi, nice to see you again.
Same here.
So we've all been told about the toll excess weight takes on our hearts and other organs. We don't really think about the physical structure of our bodies. So what gets affected?
So excess weight obviously directly is going to lead to overload on certain structures, basically the knees, the hips, the spine, and the ankles. And because cartilage is not designed for constant overload, these joints will frequently wear faster. And interestingly enough, before there's heart disease, sometimes people develop joint damage. So that can be sometimes a small red flag. So from a scientific standpoint, excess weight is always going to lead to further destruction of the cartilage much faster than usual.
Now, why would even just a small amount of weight make such a difference on a joint?
Well, because joints, it's very interesting. Joints multiply the weight. So each pound removes around 4 pounds of excess pressure on the joints. So if we calculate 10 pounds, that would remove 40 pounds of pressure from the knee with every step. That's why patients, when they lose weight, they feel tremendous relief quickly, not years later.
Can joints damaged by excess weight actually repair themselves, or is the damage permanent? And how much is a factor is the age of an individual in terms of recovery?
So unfortunately, cartilage does not regenerate fully. Even with certain therapies now that we have that could promote cartilage regrowth, we're not there yet. So age does matter, but what's more important is early intervention. So rate reduction, strengthening exercises can reduce inflammation, and sometimes we need a little bit of help with certain injections, cortisone or others, in order to relieve the pain so we can further the strengthening of our articulations.
Now, some people say that building muscle can go a long way in helping to protect the joints. Is that true?
It's 100% true because most people use braces all the time, but we have a natural brace, which is called muscles. And the muscles that are around our joints are going to, if they get stronger, they're going to cause less stress on the cartilage and better joint alignment. This also improves neuromuscular control, shock absorption, and it lowers the risk of injury and slows the degenerative changes.
So overall, though, what would be your advice and the best way for us to take care of our joints?
So we have to protect our joints early. So we have to reduce the load, we have to stay active, we have to strengthen their muscles, and especially not ignore pain. Because when pain is there, that means stop, something's wrong. And that's when we have to assess what's going on in order to lengthen the exercise period that a patient can have and continue strengthening their muscles, etc., and having a normal activity.
Okay. Thank you so much for joining us tonight.
My pleasure. Thank you.